Welcome to the South Asian Public Health Association Spotlight Series, the platform where we spotlight the remarkable journeys and career trajectories of trailblazers in public health, with a special emphasis on the South Asian community. We're your hosts, Amish, Partnership Coordinator for the South Asian Public Health Association, or SAPHA, and Mushira, the Events Planning and Professional Development Committee member for SAPHA. SAPHA is an organization dedicated to advancing the health and well-being of South Asians in the United States and the communities in which they live. It has been instrumental in fostering collaboration, advocacy, and research to address health disparities and promote equitable health outcomes. Today marks a special occasion as we continue a series of interviews commemorating the 25th anniversary of SAPHA. As your hosts, we're thrilled to delve into captivating conversations with influential figures in public health. Stay tuned for inspiring stories, insightful discussions, and a closer look at the impactful work of SAPHA over the past 25 years. You can learn more about us and explore the wealth of resources we offer at www.sapha.org, sapha.org. For our ninth episode, we're honored to have Samira Khan here with us. Samira is the current president of SAPHA and has been with the board for 7 years, starting off first on the fundraising committee, then transitioning to the secretary position, and now is in her third year leading SAPHA as our president. Samira also is an assistant director of research and clinical initiatives in the pulmonary department at the Icahn School of Medicine at Mount Sinai. Samira, welcome to the SAPHA Spotlight series. We're so excited to have you on with us today.
I love being here.
Excited to have you on, Samira. Let's talk a little bit about your journey in public health. Could you share a brief overview of your personal and professional journey in public health and what initially motivated you to pursue this path?
Yeah, of course. So I think like most people, or not most, but a majority of people who've gone into public health, my starting in this area was with the desire to pursue medicine. And so I think just growing up, I was always interested in medicine. There's a lot of people in healthcare in my family, but I also had a lot of interest in politics and journalism at one point. And so I think when I was in high school, I was super ambitious and wanted to pursue an MD-JD program. That did not, thank God, happen. But that was basically what started this interest in this field. And so I went to City College, a CUNY City College for undergrad. And I was initially majoring in biology, but then changed over to psychology because I just thought that it was more interesting, to be quite honest. I was really fascinated by just studying cognition and like the different aspects of psychology and understanding human behavior. And so I ended up minoring in biology instead. And then after a couple of really unhappy stints with organic chemistry, I decided that maybe I should just take a break. And I started working as a scribe at an ophthalmology practice because I still was very interested in medicine and I loved interacting with patients. At the same time, I had continued working at the New York Psychiatric Institute, which I had started in undergrad, where I was working as a research assistant, looking at essentially improving cognition in patients with schizophrenia using aerobic exercise. And so that was my first foray into the research world and learning how to write grants, how to recruit patients. And then somewhere along the way, I found out about public health. It had some sort of intro to it while I was in undergrad as part of the Macaulay Honors College with CUNY City. We were basically able to go on a study abroad trip. And so I had gone to India at the time. I went to Jamkhed, which is a little village near, I think, 8 hours away from Mumbai. And we were studying at the Comprehensive Rural Health Center. And it was a 3-week immersive, just looking at international health policy. And we were able to, at that time, study alongside the founder of Jamkhed, and the Comprehensive Rural Health model. And he had studied at Johns Hopkins and really implemented what he had learned in Jamkhed. And so he would go around taking, like village health workers, a lot of people who were at the time considered like untouchables, divorced women who were single, and creating a safe haven for them and training them into becoming community health workers, and then going around into their village and really, delivering some of that service and those needs. And then he had also built a hospital there. And so for all the critical patients. And so we would essentially go with the community health workers to their on-site appointments and to the village and see them in action. And I thought it was phenomenal just how much of an emphasis there was on community and integrating that into treating health. And it was so different from the model I was used to here. And so that was something that was always in the back of my mind as I was on this journey. And so I was like, why don't I, pursue a master's in public health while I'm continuing to torture myself studying for the MCATs. And that, quite honestly, was the best decision I've ever made. I went to Hofstra for my master's and it was life-changing. It was a small program, but it was so immersive, and we just had a lot of discussions and dialogue. And one of my professors, Dr. Hackett, she really opened my eyes to the possibilities that there are in public health. And we would have a lot of conversations about how I can still pursue the ultimate goal that I have of caring for patients and trying to improve health outcomes, but on a grander scale. And I could always think out of the box and pursue something like that. So that was something that I was really, just thinking about as I was looking for opportunities to work in public health. And that's how I came across SAPHA. When I had found a job at Mount Sinai Hospital as a research coordinator, focused on sleep apnea and cardiovascular disease, because I was always interested in heart disease. It's something that was rampant in my family, and as most South Asians can relate to. And so that's where my entrance into Mount Sinai came. And then somewhere along the way, I just in both areas started to advance and really, found SAPHA on, I think it was the Chai Chat at APHA. I was like, oh, there's this event that's focused on South Asian health. Why don't I go? They were looking for people for the board of directors, and I applied. And then that's basically how I got here.
That's amazing. I will also just add, OChem killed my bio GPAs.
Yeah.
So just don't feel too bad. I think we're not in the minority here on that.
Yeah.
So you got into this a little bit. Could you share a little bit about SAPHA's history, mission, and vision? You've been here for 7+ years now. What inspired you to become involved with SAPHA, and how did you develop your passion? You're just very passionate about advocating for South Asian public health on a much broader scale.
Yeah, so SAPHA has been around since 1999. It's actually its 25th year anniversary, as you all know. And so I had never heard about SAPHA. I didn't even know that people worked in South Asian public health. And to be quite honest, I didn't even know that public health was a field that you could have a career in until I started my master's. And that was something that we talked a lot about through the Hofstra Alumni Association. Just how do you reach out to undergrad students and even high school students to talk about public health? Because it's so embedded in everything that we see, from OSHA regulations to the FDA to, COVID and just the seatbelts, all of that is public health. Everything is public health. Actually, one of my assignments was we had to go around our neighborhood and take pictures of something that was public health. And it was everything is public health. And so it's something that the society runs on. And then, in terms of South Asian South Asian health, South Asian public health, growing up in, Long Island, we had a very tight-knit community because it was predominantly a white neighborhood. And so, it's much more diverse, but my mosque was essentially the center of all things community for me, and really helped me stay in touch with my people. And they used to have health fairs there. And it was just really nice to see how we all just take care of each other and how community is so integral to ensuring that people are doing well. And again, it was something that wasn't very traditional about healthcare and medicine. And through that, I was, just wondering about why there were so many South Asians who had high risk of cardiovascular disease, so many health problems, when we also have so many doctors within the community. I didn't understand where that disconnect was. And so for my thesis, I was actually looking at the health behaviors and how it was influenced by providers, and where that communication gap was with patients, specifically in the Muslim community. And so through a lot of qualitative interviews with people that attended my mosque, a lot of it was that they didn't feel comfortable talking about their health. They had a lot of whole beliefs that brought in from Ayurveda and just from their own cultures, that they felt that a lot of healthcare workers didn't understand. And so that that basically put up this wall where they didn't want to go to the doctor. They didn't think that they needed it. Healthcare access was a huge issue. And, they felt a lot more comfortable if the doctor was someone that they knew that was part of the community that looked like them, But unfortunately, because of the area where we live, that wasn't always the case. And then on top of that, they would get handed lists of medications or like list of instructions, and they didn't really know what to do with it. So that health education aspect was also really not there. And even amongst people who had high health literacy, it was like, oh, like, do I really need this? Or, can I just, do something else? Or just not having the bandwidth to take on ownership of their health or ownership of the health of their family. And so that really bothered me because we have so many things at our resources and available to us, but it's not something that you can put the onus on the patient, right? Through all these conversations, it was very apparent that there's a lot of determinants of health that were at play, and it was a really big structural issue. And that was something that I think really inspired me about SAPHA and public health in general, was that it didn't just treat the patient, it treated like everything as a whole. And so the work that SAPHA was doing at the time was really just inspiring to see how they tackled things at a bigger level, the advocacy level, research level, and they were looking at things that were beyond medicine and really integrating the social and behavioral determinants of health. And so that's what had drawn me to SAPHA, and just seeing all the vibrant people at Chai and Chat that year when I had gone and listening to them tell their stories and their journeys, it really opened my eyes to the possibilities of what we can do in the South Asian community and embedding public health other than becoming doctors. And so that was really what drew me to it, and really started the journey of advocating for South Asian public health.
Yeah, no, thank you for that. And then honestly, that was sort of the way that you got introduced to SAPHA. And we've come such a long way, and you have so many amazing accomplishments. And we'll talk a little bit about that in a bit. But for aspiring healthcare professionals who are listening to you and just witnessing your journey as you're talking about it, how do you think your experience with SAPHA and then other organizations that you may be a part of, like you mentioned the mosque community also, how has that, in terms of your career, how does that shaped your career in healthcare and community engagement? And then what are some critical lessons learned that you feel might be important for these emerging leaders to be aware of?
Yeah. I think getting involved with like not only just the mosque, but like this organization, I was also part of these public health, the Hofstra Alumni Association for a few years. It really opened my eyes to how different it is from academia, which is where a bulk of my time has been. Academia and then like the clinical route, where it's just there's a lot of red tape, there's a lot of structure, and there's a lot of things that you can't do to engage the community. There's a lot of, and I think that was what I felt like was missing, was I felt very impactful doing the research and doing the work, but it was really translating it and seeing it implemented or advocated for on a policy level. And so I think doing a lot of these experiences, even in undergrad, going to India, showed me that there's different ways of looking at things, and what's really important is what impact do you want to make on the world, as opposed to what do you want to do with your life. When people ask me, where do you see yourselves in 5 years, or like what's your next step in your career, I have no idea. It's like I don't really know what I want to do with my life, but I do know what impact I want to make, right? I see all the catastrophes around me, and I want to make that better. How to get there, there's so many different ways to do that. And I think if we focus so much on what a career looks like and what a job is supposed to be, it really stifles that creativity in developing solutions for a lot of the world's problems. And so I think getting involved with SAPHA really showed me that there is so many ways to do something that isn't traditional, right? Even with research, doing research in a different way, like different methods of research that doesn't involve recruiting patients in clinical trials, and involves more community engagement and just staying in touch with people, and really it's kind of like, this is a very bad analogy, but like the farm to table methodology, where it's like you grow your food and then you bring it and you eat it, but it's like you do the work and then you bring it to the community and you show them and you integrate what you've been doing and implementing it and really involving them in the process, because we have it's not enough to have people that look like us doing the work, but there needs to be that partnership with the community and the integration of like people who are being affected by what we're doing. So in terms of like lessons, and what I would suggest people do is really like when you have the time, do the different internships, get involved in different organizations, and try to see ways in which you can grow your impact as opposed to being very focused on like a timeline and like I need to get be this person or be this thing by XYZ year.
That's amazing advice. Yeah, I totally understand, getting involved, figuring out what you do and don't like, absolutely critical as you're moving up in your career. So just transitioning to mentorship and career influences. You've talked about this a lot in some of our meetings and some of our retreats. Reflecting on your career, were there any mentors or role models who significantly influenced your professional path? What advice would you give to emerging public health professionals that are looking for mentorship?
Yeah, definitely. There have definitely been a lot of, I think, mentors along the way. Just to start off with, when I was in undergrad, the PI that I had worked with at the Psychiatric Institute, Dr. Kimi, he was really, really big on teaching. And even though I was a volunteer, even though I was just a research assistant, I was really integral to the team. And he focused a lot on professional development. And so a lot of the skill sets that I learned in research, I could, attribute to him. Just understanding what is a grant, like how many PIs involve the bottom of the totem pole in those decisions and like talking about what that means. But he always treated us like equals and as equal members of the team. And so I learned a lot through him. And then after that, at Hofstra, my professor, Dr. Hackett, she, I think, was the person that was there at the pivotal point of where I decided to pursue public health as a career. And we had a conversation about like, just why I was so like adamant about doing medicine. And she was like, with medicine, you'll be able to make the impact that you want, but you right now have a lot of out of the box style of thinking. And when you go through such hard schooling, basically, you might not be able to retain that out of the box style thinking because you have to kind of forget about that to be able to memorize and deal with the structure. And she asked me, like, do you want to risk that? Do you want to risk, losing the creativity and the ability to just think up big ideas and try to implement them? And I was like, no, I don't want to do that. So that was basically what helped me, I think, really just full on embrace public health. So I'll never forget that moment as well. And then later on, obviously, the current PI that I work with, Dr. Shah, she has really helped, I think, empower me to take on leadership roles and to find my voice and to stand up for what I believe in. And then, of course, I'm sure all of you have known, like, just hear me mention all the time, Dr. Arnab Mukherjee has been such an integral mentor to, I think, every past SAPHA president or SAPHA member. He sees you as a part of SAPHA and he will take you on as a mentee. And so just brainstorming with him, talking about like what's SAPHA's next step has been so helpful, even from when I first started. When I first joined the board was a lot smaller. And so it was kind of like a little family. And we had Shipra and Memuna and Yusra, and, Arnab was always there as an advisor. And just like learning from so much from them because they really had that connection of ties to the founders of SAPHA and the journey along the way. So learning about SAPHA from them, learning about how to run an organization, the different struggles, what works, what doesn't work. It was really a privilege to be able to work with them for so many years, especially Yusra. I was essentially with her for 5 to 6 years and really learned the ropes from her and Shipra both. And then after they left, Arnav really came in and filled the role of just guiding me along the way and helping me whenever I had an issue. And just really thinking about how to take SAPHA to the next level. And I would say that a lot of these people have been the most integral. And of course, my parents, my dad, since like at the beginning of time, has always taught me to critically think. We would have I love to read. So he would take me to the library and he'd be like, you can put whatever book you want, but you also have to pick basically an autobiography or a nonfiction book and then write a report on it. Which I don't know why I enjoyed doing that, but I did. And then we'd be watching the news and he'd put on Fox News and like, why are we watching this? And he's like, you have to understand everyone's perspective because how can you argue against it if you don't know why they're saying it? And you have to understand why they're saying it. So it was a lot of that. We would just watch every possible news channel and like discuss it and try to understand things from other people's perspectives, even if we didn't agree with it. So I think that has always been something that I've held on to along the way as well.
No, thanks for sharing that, Samira, and your dad. Awesome. Sounds like a wonderful person.
Yeah.
Um, and you mentioned something that really resonated, or at least, I just felt like that is so true of you, the gift to think outside the box. And I'm glad that you had a mentor who recognized that in you, because we at SAPHA are really blessed to have that, in you as a leader, in terms of all that we have accomplished since you've, took the charge. But there was also something you mentioned earlier on, which was around the challenges that you observed in the community, and you do bring a wealth of experience into the work that we do. And so, you talked about complementary and alternative medication and how there might be some cultural incongruence there in terms of healthcare professionals not really appreciating or understanding all of these. And sometimes they can be barriers, absolutely. And so patients might not even disclose, right, that they are using Ayurvedic or homeopathic or Unani medicine, which can also lead to diverse or adverse outcomes. So let's talk a little bit about healthcare challenges in South Asian communities, and specifically your involvement with SAPHA. How has that deepened your understanding of healthcare challenges within our communities? And then, of course, what strategies have you and SAPHA employed to address these issues effectively?
Yeah, I think through SAPHA, it really expanded my understanding of the different things that afflicts the South Asian community. I think before I even knew about anything public health, it was very obvious that cardiovascular disease was a huge problem in South Asian communities, and not really something that we shied away from. Everyone kind of just laughed about it, like, oh yeah, we all have heart problems. Right, like you're still gonna eat the jalebis and the gulab jamun, like it's just, or that, and diabetes prevalent, everyone has it. And so there wasn't like the stigma around, but there was also no one really addressing like, why is that the case? You're just saying it's the food, but what else is causing that? And then when I got involved with SAPHA, I think it really opened my eyes to all the other issues that is very prevalent in like society and communities, right? But isn't talked about because of the stigma. I mean, mental health was, as a psychology major, like that was always something that, was talked about in the broad sense, but never specifically within the South Asian community. Um, there was also, aging and Alzheimer's and dementia. Like I've seen people afflicted by it, but everyone just kind of wrote it off like, oh, it's just people are getting old. A lot of things that wasn't talked about, right? Like the LGBTQ health, definitely not talked about. Violence against women, like it's just, these are all topics that afflict our communities, but we don't talk about it. There's a stigma surrounding it. There's not enough data, right? That's the other problem, is that like we always knew, or I always knew, that there wasn't information out on it, especially when I was working on my thesis. It was very hard to find any papers. But the fact that like it's just such a prevalent problem that we get, there's just, everything gets aggregated as Asian, and that I didn't realize that there was such a big push for disaggregating that data. And it was nice to see that there were so many people who were working to do that. And I think getting involved with SAPHA and seeing the work that everyone was doing to try to push for that really provided hope in that, like, okay, we can eventually get to this. But first we have to understand what that looks like. And meeting so many researchers who are doing this work. I mean, even like you, Mashira, the fact that you're working in like the aging sphere with South Asians, like I didn't know that people did that. So just meeting people who are like basically focused on South Asian health, and learning from them. And I feel like I've learned so much from everyone on this board through all our retreats and all the conversations. And everyone brings such a wealth of knowledge in the different areas that they have expertise in. And really knowing everyone and understanding that helped. And just seeing the vast amount of work that's being done behind the scenes that no one's talking about. And I think that really motivated me to ensure that SAPHA highlights that work and elevates it and partners with people who are doing that work. Because if we keep working in silos, it's like people will do the work, but it doesn't really add to the big picture. And it doesn't help solve that problem of disaggregated data. But if we all come together, if we all combine our resources, we'll be able to make that dent and provide all the information that's needed to help first get the data, then use that to understand the community, and then advocate for it and advocate for our resources, and really use that data to our leverage, and listen to all the experts who have this wealth of knowledge, and give them the platform to be able to help us advocate.
Thank you so much. Yeah, Totally agree. I think sometimes we can make things so much bigger than they need to be, and really, just focusing on, how are we going to move the needle, even if it's a small thing, is getting people together. So really appreciate your reflection on that. Samira, in terms of memorable moments at SAPHA, what have been the most rewarding and enjoyable aspects of your leadership and involvement with SAPHA? And then could you share some initiatives or accomplishments during your time as the president that you are the most proud of?
Yeah. I think the most rewarding and enjoyable aspects is just meeting people. I feel like we have like a little family now at SAPHA. It's like all the people I've met throughout the years, in the 7 years, like I think of them so warmly, and it's great. Like whenever I see them or touch base with them or reach out to them, having conversations with them, it's so enlightening. Even though we are all like different parts of the country, different parts of life, it's just it's very just nice to meet everyone, especially when we get together at APHA. Back in the early days, we would actually have a mini retreat in person. It would mostly be like a dinner where everyone got together and talked, but it was just really nice to have that aspect of community. I think because most of the time we're all doing this work in a little bubble. And so to be able to get together with everyone else who's passionate about the same thing that you're passionate about, combining your energies, it really is just so motivating and so inspiring, and it makes me want to do the work even more. And so that's what I love about SAPHA, that yes, like it's great to do the work, but then to have the people to do the work with, it just, you're constantly feeding off of each other and like constantly motivating each other, and that energy is really, I think, what helps to drive some of the work that we do. And then the other question was on initiatives and accomplishments. So since I've started, when I first started on the board, like I had mentioned, we were pretty small. And I think the formative years of the time on the board was spent on building that foundation, and really, I think, providing the structure, and just giving us the ability to then accomplish what we needed to. And so I remember underneath both Memuna and Yusra's leadership, we had spent a lot of time just figuring out governance, figuring out how to expand our board. And a lot of these ideas that we are implementing now came from those discussions back then. And really, I think even under Yusra, we had so many great retreats where we would just focus on like, what is our mission? What is our vision? What are we doing here, right? We really, I think, talked about how when SAPHA started, a lot of it was professional development, bringing together other professionals, focusing on the research. But over the years, it really evolved into advocacy being an integral part of what we do. And so during those times, like those retreats during, I think, 2020, 2021, when we had so many crises happening around the world, it was very evident that, advocacy was something that we needed to do. And one of the key changes that we made to our mission was that, we were promoting the health and well-being of South Asians in the US, but the addition that we made was, and the communities in which we live, because of the fact that we don't exist in a silo. We are part of the communities around us. And so what affects our communities affects us. And that was something that we had discussed during the Black Lives Matter movement, where it's like, we can't just stay silent when we see atrocities happening to our neighbors, because it's going to then affect us, right? And so it's important for us to speak up and to advocate for people who are, our neighbors, who are within our communities. And so that was something that became very integral to the work that we did, where it's not just South Asian health, but it's also, everything that affects South Asian health, the different determinants of health. And a lot of these are structural issues that don't just affect us, but affect, Black people, it affects Latinos, it affects other Asian groups. And so we can't just work we have to work in tandem with these other organizations and find a common cause and to advocate for, whether that be climate change or, just bringing awareness to some of the structural issues, inequities that exist in this world, addressing problems that are happening in our community, gun violence. These are all things that affect us. And if we stay silent when they occur, it's still going to come back and harm us. And so I think that's really one of the biggest foundational work that we had done during those times. And then understanding how to lead and govern. We had set up operations manuals, restructured our bylaws, and these are all the things that happen in the background. And people don't realize how much time is spent doing that. And so when Yusra left, when her presidency ended, I basically was handed a playbook of like, hey, we've helped build SAPHA. We've fixed out all the issues, we've worked out all the kinks, and like now it's a well-oiled machine. And so then when the new board came on, everyone came on with great ideas, with a lot of energy. And it was so easy to then just kick off these projects because we already had the foundation set. And we had like worked out like the website that was, I don't know how many years in the making, our new website. And so we were able to finally launch that. We were able to finally launch our Instagram page, really advance our audience. And then we had like these partnerships that had been built through NCAPA, the National Council of Asian American Pacific Organizations. And through that, we were able to get a seat at the table, essentially to advocate for South Asian health and work in tandem with all these other organizations that are doing the advocacy work, that are doing the work on the ground. And so again, that was something that had come through like the foundation building years. And so through that, we had, we were invited to roundtables with the Secretary of Health. We were invited to Washington, D.C. And it seems like nowadays it's like every other day we're down there in D.C., we're at some event advocating for South Asian public health. And we couldn't have done that if we didn't have that foundation and all the partnerships with these other organizations. And even the research aspect, right? So I would say that with SAPHA, the main areas that we do our work in is the health education through our webinars, through research, through advocacy, and partnership building. And when it comes to the research aspect, our research co-chairs, Aisha and Anto, they've been on the board for many years now. They joined, I think, when Yusra was leaving and I was starting. And so it was nice to have people who also had seen some of that foundation building. And thanks to their hard work and their leadership, we have a health disparities report coming out at the end of the year. And that is, again, a project that was in motion for so many months, so many years, so many people were involved in it. And it's essentially like, we had the brown paper that was published before that laid the land of South Asian health. And now this is going to be basically another reiteration of that, but looking at it in 2024. And so we've had a lot of great successes, but it's really so many years in the making and so many people's hard work in the background contributed to it. So I think I've addressed that question.
No, that's awesome. And I wonder if you want to talk a little bit more about, because you're very modest, Samira. I know we published a paper while you were, just in your initial days at
Yeah.
SAPHA. There was the COVID grant, and there's current initiatives also. If you could very quickly just, talk about those, and then our APHA presentations and whatnot. I mean, there's always so much going on at SAPHA, and we would really like you to sort of just, for those who are not aware, just to give, a quick snapshot of just a day in the life of a SAPHA board member.
Of course. Yeah, I always forget about what I'm actually working on at the moment because I just spend so much of my time trying to find all of our accomplishments. But yeah, I think in terms of like just expanding on the research, right? When I first started, I inherited a grant that we had gotten from NCAPA on COVID outreach. And so that was, I think, my first time leading a grant project solo with the help of a lot of people on the board. But it was great. Through that, we were able to establish we outreached to 20, 25 organizations, really got to know the work that they were doing on the ground, and setting the seed for, developing those partnerships. And then through that, we were able to get interviews that we recorded, and we're in the process of writing a paper on that. And then, of course, every year we try to make sure that we have a presence at APHA through abstracts. And so we had submitted an abstract on I think it was like the social determinants of aging and mental health, and it was a scoping review. And so we are expanding on that as well. When I had first started, we had just finished a paper that was published on violence and just the health implications of violence against South Asians in the U.S., and which has been referenced, unfortunately, many times in a lot of the statements that we've had to put out. And how, again, just going back to the fact that there's a lot of other determinants of health that are out of our control, but it's a system level that we need to address, and how state violence and hate against South Asians can impact our health and worsen our mental health and worsen healthcare access even. And then in terms of grants, that's a new territory that I think we have been going into full speed ahead. We recently applied to an NCAPA grant on racial equity, and we received that. It's a $20,000 grant that we just got this month. And it's focused on, essentially addressing misinformation in health in the South Asian community. especially because as we saw during COVID, so much misinformation is being spread via WhatsApp, and how to really reach all people, like all ages of the spectrum, right? You have people on social media resharing things on Instagram, on Facebook, on TikTok, and then you have people on the other spectrum sharing things on WhatsApp. And so our goal is to essentially understand how people are getting their health information, specifically focusing on reproductive health, mental health, and other, health priorities that SAPHA is focused on, where people get their information from, what their health beliefs are, and what their, perceptions are. And then developing toolkits to help address that, to help, address the misinformation and disinformation, and then disseminating that toolkit through webinars and really educating people, and then understanding how people's perceptions of health have changed since then. So that's a current grant that we just received, and we are excited to start. And then, of course, we've applied to, I think, a WINAPI grant, which we'll see what happens with that. That one was also focused on addressing hate in the South Asian community. And we are working on a PCORI grant, a patient-centered research grant about building capacity to address mental health in South Asians in the US. And then, of course, we are sub-awardees on grants that were brought to us through board members and mentors. So Dr. Arnab Mukherjee, he is one of the PIs for the CARE grant, which is focused on essentially developing a repository of Asians and South Asians who either are afflicted by dementia or aging, or might be South Asians who qualify and eventually or caregivers, but really just creating a repository so that people who are doing research on Alzheimer's disease and dementia can reach out to these South Asians and include them in their research specifically for that. So we are helping with recruitment for that study. And then we are also sub-awardees on a SEAL grant, which is focused on diabetes and community health workers. And that was brought to us through Malini, one of our board members at University of Texas in Dallas-Fort Worth. So we are really doing a lot. It's a lot of productivity, so a lot of grants. We've also obviously kickstarted this podcast series, a lot of events. We've had, I think, back-to-back events this past 2 months, and we have another one coming up next week on just webinars and stuff.
Yeah, no, there's so much going on and such amazing work. There's also the Chine Chat that we do every year, like you mentioned, which is again an excellent opportunity for especially aspiring healthcare professionals to get together and just learn more about the work that SAPHA is doing and how they can get involved. And we really found some really good board members through the Chine Chat events. So no, thank you so much for sharing that, Samira. So let's look to the future now. And, like you said, over the past 25 years, this being such a milestone year for SAPHA, we've made tremendous strides, from obtaining 501c3 status to publishing research, like you mentioned, engaging in advocacy, forming those critical partnerships. Where do you believe SAPHA can have the most significant impact in the next 25 years as it looks at these health disparities and addresses them and promotes equity in South Asian communities?
Yeah, I've had a lot of people ask me this question about where, what is SAPHA's goal? What are we doing next? And like, where do we see ourselves? And I've been thinking a lot about this, and I still think that it's, we have the ability to make an impact in so many different areas that it would be a disservice to us and the South Asian community to just focus on one thing, because we have that unique position of being the go-to organization for South Asian health. Even now, 25 years later, there are not many organizations that are focused on overall South Asian public health in the US across the country, not just localized to a state, but really the entire cohort of South Asians. And that is us, right? We are that central hub. We are able to connect researchers to community-based organizations. We're able to connect community organizations to, work together to advocate for priorities. And so it would really be a disservice to try to just pigeonhole ourselves into one specific area. And so I think where we could make the most impact, or what I would love to see, is us being that central research hub where people come to us because we have the connections with the community-based organizations to help engage the community in research. So connecting researchers to community, I would envision us to be that. but also helping to develop some of those research ideas. One of the things that I would love to see is just getting a health, essentially understanding what health looks like in South Asians in the US, doing a huge health needs assessment, working with researchers across the country to understand that and develop cohorts. There are studies like, for example, I know there's a Masala study that looks at South Asians in 3 different areas and looks at cardiovascular disease specifically, but then you also have studies like the Hispanic studies of Latinos. There's the MESA study that's looking at I think it's like atherosclerosis in Americans across the US. But I would love to see just a massive community health study looking at South Asians and tracking them over the years to really see what's afflicting us. And so really, I think establishing ourselves as that research hub would be wonderful, and working with like health departments and whatnot. I also would love to see us as that advocacy hub, really taking all that research and then taking it to legislators and advocating for laws that will help us. For example, like the South Asian Heart Health Bill. That's something that we have helped advocate for, to get more funding for research to look at cardiovascular disease. And then training the workforce. I would love to be, that pipeline to help take young South Asians who are interested in South Asian public health and growing them in the next few years. Through event plannings and like other webinars and being like, providing CME credits, for example. So yeah, that's what I would love. And then I think one other thing I would love to see is for the organization to grow. I would love for us to have an executive director, permanent paid staff, so that it's not just volunteers running everything. And really just expanding to having regional chapters, having a coalition that we can oversee, and really just getting more people involved in the organization. Hopefully having an office one day and just like an actual address would be nice. But really just growing the organization to be a big nonprofit.
Absolutely. So as we close the door today, we've talked about the past, we've talked about the present, we've bridged towards the future now. And so Samira, as our leader, can you just say a few words about how we best can cultivate or foster leadership within these South Asian communities, and what role you feel like leaders can help in improving healthcare outcomes, and just what closing advice would you have for those that are really aspiring to work in the field of South Asian public health, particularly that want to be leaders and really take the space and be put us on the right path forward, you being such a visionary leader.
Thank you. So I will say that a lot of these leadership roles I kind of walked into accidentally, and most of it was because I just was really, I'm one of those kids that was volunteering for everything because I wanted to be involved. I wanted to do the work, even if I didn't really see what I was going to get out of it. It was just like, oh yeah, like that seems cool. Let me take it on. Let me get involved. So same thing with SAPHA. I think when I joined, it was 2020, it was like the beginning of the pandemic. I was working from home. I had so much unlimited time. I basically signed up for every single project that we had going on because I just wanted to know what we were doing. And then somehow I was involved, and then that was what positioned me to become president was, hey, like you're involved in everything. You know what to do, so you can take over. And I was actually very adamant about not wanting this role. And both Yusra and Shipra had to convince me. They're like, there's no one else that can do it. I'm sorry, you have to take on the role. And then here I am. It was like a lot of these things. It's just even the achievements that we've had in SAPHA, a lot of it just comes from me saying yes. Or being like, okay, that looks cool. What if we did that? And then not realizing what it's going to spiral into. Like the fact that like, hey, like, yes, why don't we go moderate this panel? And then next thing you know, oh, also they're having an event at the White House. You can come to that too. And it's like, oh, okay, that's great. So I think just don't be afraid of taking on roles and like signing up for activities, because you never know what it's going to lead to. And especially if you're passionate about it, that passion shows very evidently. And then people just automatically see you as that person to go to because they think that you're a good fit for it, because you're so enthusiastic, because you want to do the work. So sign up for everything, but get involved. I think that's the biggest thing, getting involved in things that you're passionate about, because you'll enjoy doing it, even if there's nothing that you're going to get out of it. And eventually it'll help build you into a leader, because you're so passionate about it. You're taking the initiative, and those are skills that are important in leaders, especially the initiative taking. and not being like a passive participant. And then I think in terms of fostering leadership, it's really important to give back, in my opinion. I used to teach at my Sunday school at the masjid for 10 years. I retired a few years ago, and it was when I took on this role as SAPHA, because then I was working 10 days a week. It was just too much. And my students were very unhappy. And I think my last class is now graduating high school. And I was with them since they were in kindergarten. I would basically I would move up with them every year. And it was great because I developed that connection with those kids, and they felt comfortable coming to me and asking me about things. And we had a great relationship. And it was a lot of what I focused on was not just teaching them, but helping them feel confident in their decisions and feel confident in like doing things that they're passionate about. And so I think it's very important for us to give back to our communities in that aspect and develop those relationships with people. And that includes, students. So one of the things that SAPHA does is we have interns and we have committee members that we bring on, and we spend time mentoring these interns, mentoring these committee members, and getting them involved in the work that we're doing so that we can then mentor them and grow them into leaders as well. And I think that it's important that all organizations do that, and that, no matter how far up you are on the totem pole, you can always help influence someone. And it's not just someone that is at the same level as you. We have to go back to these high school students, to these college students, and help grow them, because otherwise people are going to be like me and never know that public health is a field, right? Like you can actually go into. And it took me so long. And one of my biggest things is I wish I had known that public health was a field that I could study, and I would have studied that in undergrad, because it's just such a great thing that I love doing it. And so I think we really need to target that outreach to the youth, and help foster that. But yeah, in terms of just closing advice to people, I would say get involved, find what you're passionate about, and really pursue it. Because even though you might not see what the clear vision is, eventually you'll get there and you'll be doing what you love doing. And really focusing on what impact you want to make as opposed to what it is that you want to do, because then you'll be happy with what you're pursuing. Because you're motivated to do it because you're motivated by that cause that you're trying to solve, essentially, as opposed to just chasing titles and jobs. And I think it's just more fulfilling that way.
That's really great advice, and I'm sure that emerging leaders who are listening to you, they probably, it's just such just listening to you has been so inspiring, honestly, your whole journey, and your ideas and your vision for the future for SAPHA. Well, thank you, Samira, for taking us on this incredible journey through your experiences and your insights. Like I said, it's been an absolute honor to have you as our guest on the SAPHA Spotlight series. And to our listeners, thank you for joining us on this milestone episode. Do stay tuned for more conversations with past SAPHA board members as we continue to explore the career progress of individuals who have basically paved the way for change within the world of South Asian public health. Do follow us on YouTube or Spotify by subscribing to our channel. And if you enjoyed this episode, please consider donating to SAPHA at www.sapha.org. And well, until next time, this is Mashira and Amish signing off.
Thank you.